Adult Kypho Scoliosis Case Study. Hey, I'm Dr. Chris Gubbels with ScoliCare Denver, and today I'm going to show you a unique case study, and this is an adult that has a Kypho Scoliosis. In fact, he has Scheuermann's kyphosis and scoliosis, and this is a really great case to show because in the traditional medical world, it's believed that these kind of cases cannot be improved. But this is a patient that had a really great outcome. In fact, his case was selected to present at an international research conference as a poster presentation. And it was actually written up and published in a scientific peer-reviewed journal. And I'll give a link to that at the bottom if you want to go and check out the journal and read the case and where it was actually published. But to start off, let's give a little bit of background about this patient and the case. This was a 26-year-old male that lived in Colorado, and he presented to our office because he was dealing with chronic pain, and he had a professional job or career, but one of his hobbies was actually rock climbing, which is actually a pretty popular thing to do in Colorado. But if anyone's ever rock climbed, you know you typically have to do a hike up to the point where you begin climbing a mountain, and you're typically carrying your gear, a pack with ropes and all of your other climbing gear. And his back pain was getting so bad that he could not physically climb. Not that climbing caused a lot of pain, but he couldn't actually do the hike to the point where to do the climb because the back pain was too much, and they had increased back pain just being able to carry his gear. The other thing is the biggest concern, and which is often the biggest concern, was his physical appearance. He actually did not like how he looked because he could tell he was becoming really hunched over. In fact, physical appearance is the number one reason for people seeking treatment in both adolescents and then also in adults. Adults, it's usually a combination of people don't like how they look, and then also pain that's a motivating factor. We actually use an outcome assessment called the SRS-22, where we can actually grade how someone views their spinal condition impacts their life, and I'm going to go over that with you. Now, if you're an adult and you're watching this case study, be sure to click on the link below and download our free ebook called Scoliosis Knows No Age Limit, and that's a really good guide on scoliosis in adults and different treatment options. So as I mentioned, this was a 26-year-old male. His primary complaints was back pain, posture, and his appearance. He was having difficulty standing or sitting for extended periods of time, and he was having difficulty rock climbing. The biggest difficulty with rock climbing is he couldn't actually do the hikes to be able to do those. This was some of his past treatments. When he was younger, he did wear a traditional scoliosis brace, a TLS brace, but it was a Boston brace. And he's had epidural injections as an adult in his younger 20s just for attempted back pain relief, but they weren't really that successful. Some of his outcome assessments, so his rated his back pain about a 7 out of 10 at worst on average. Some of his outcomes, he rated his back pain about 7 out of 10 at worst before coming in for treatment, and on average it was about a 4 out of 10. Outcome assessment we do called the Oswestry Disability Index, he scored an 18. And his SRS-22, which is basically a questionnaire that grades how someone views their spinal condition is impacting their life, he graded that at a 3. So we can see where these different things got graded, and his lowest overall score was his self-image, meaning the number one thing in his mind that impacted him was he didn't like his physical appearance. So this was Nick when he came in to see us, and you can see his body is really shifted over to the left from the scoliosis. Here you can see the scoliosis in his left lower spine when viewed from the back. And when we look at him from the side, you can see he has a pretty big curve in his mid-back, and his head is really starting to protrude forward, hence his bad posture. Now, these are some of his x-rays before. When we look at these x-rays, the green line would be considered normal or ideal, and the red line was his. So he had a really large anterior head translation. You can see he had this hyperkyphosis where he's bending over. This is looking at his lower spine from the side. You can see here his x-rays of his lumbar spine, he has this curve in here that was about 31.7 degrees, so 32 degrees scoliosis. And he also has a pretty large sacral obliquity, which is basically an unleveling or an unsquare sacrum, which is definitely contributing to the scoliosis. Now, he had a few different treatment options. One of those was to wear a custom hybrid scoliosis kyphosis brace, and that was to start at 2 hours a day and then increase to 2 hours a day. And the goal was to wear that part-time 8 to 12 hours, and also at home to wear or use a lumbar scoli roll. This is used to increase mobility in the spine, to start off slow and increase it to 20 minutes. And then we actually gave him a 6mm full-length lift to put in his shoe to actually deal with the anatomical short leg, because you can see his leg is actually short here on the left side. This is Nick actually in his brace. So you can see in his brace, he has, after 1 month, he has really good alignment. The brace is holding him upright. Also from the side, it keeps him from hunching forward. This is 1 month after wearing the brace, and you can see how much his posture has actually changed in just 1 month in wearing the brace and doing the at-home scoliosis rehab. This is him from the side. This is him out of the brace. You can see before his posture is much better. He's not as curved here. His head does not go forward as much. And you can see like in the brace how much that holds him in a correct position and how much that improves his posture. This is his x-ray with the brace on. You can see the buckles. This is an in-brace x-ray. The curve reduces down to 27.8 degrees with the brace on. And then this is him doing some of his at-home scoliosis rehab. He's laying on, we call this a ScoliRoll. It's an orthotic device that we use to help correct scoliosis. It actually helps increase mobility in the spine, which makes it easier for the brace to correct his spine. And then we give him functional exercises to do while he's laying on that. So this is putting his body in a more correct position. We'll do simple leg raises. We'll do some arm raises. We can make that more complicated if we want, having him do things like alphabets or figure eights with his leg. You'll see him doing things here. But it's some basic functional exercises he can do while laying on this orthotic device. One of the other things we had Nick do is do some core stabilizing exercises while he was wearing his brace. Here you see him doing some bird dog exercises. And then some other things we had him do was some simple dead bug exercises laying on his back. So we would do these in the brace because the spine is holding him in a more correct position. And then we're strengthening and stabilizing his spine in that corrected position. So this is when he started treatment. This was back in February 2016. And this was in my practice or clinic before we had ScoliCare. And you can see, look at his body before and how much he shifted over. This is 6-month follow-up. This is him out of his brace, not wearing his brace for a few hours. So he maintains that result and improvement in the posture with the brace off. You can see the improvement. You just look at his lumbar spine. You can see he's flat here. You can see that's indented. You can see how much more symmetry he has with the brace off after doing the treatment. And you can look at his posture from the side. This is initial. This is 6 months out of brace. Again, out of brace for at least 4 hours, right? You can see his x-rays before and after. You can see how much his forward head posture improved. You can see how much his kyphosis improved. This is before, this is after, before and after. Looks perfect in the upper thoracic and cervical spine after. And then that curve before and after as well. So before, his Oswestry Disability Index, which is it's a questionnaire you can take to evaluate how much back pain is impacting someone's life. The lower the score, the better. He was 18 before and he was 4% after. 4% is basically non-existent. It's a 78% improvement. His SRS, which is the scoliosis specific questionnaire, was 3 before, 3.77 afterwards. Again, higher is better here. The highest you can get is a 5. His pain at its worst was a 7 out of 10, and then 4 out of 10 in average. And then afterwards, his pain at worst was a 2 out of 10, but on average, he had 0 pain doing the treatment. These were the actual SRS questionnaires. You can see every single category improved. Look at his pain. He rated it 3.2 and it was a 4 afterwards. Again, higher is better on this. His self-image, which was the lowest score, he graded at 2.6 and here it was 4.2. It was almost his best score. And then overall satisfaction and satisfaction with treatment was 3 before and here it was 4.5 out of 5. This is where you can actually find the case where it's actually published. It's published in the Journal of Physical Therapy Science. We'll put a link here in the video. You can actually go and read and download that paper for free. It is an open access journal. So anyways, that was a great case in an adult with Scheuermann's disease and scoliosis called a Kypho Scoliosis. These cases are believed a lot of times they cannot be improved, but this patient showed excellent improvement in a relatively short period of time, and he was able to maintain those results long term. So if you're dealing with Scheuermann's kyphosis or scoliosis and you're not sure what to do, I'm going to encourage you to click on the link below, request a free discovery call. That's going to give you a chance to talk to me one-on-one about your scoliosis or kyphosis, how severe it is, its risk of progression, and most importantly, what treatment options you're a candidate for. Now, to learn more about the best treatments for scoliosis and hyperkyphosis for adults, click on our next video, and I'll see you there.